Hi, I'm Chien-Feng Lee from National Taiwan University Hospital. I'm glad to present the article with the prediction of mandibular advancement device response using CPAP pressure in different polysomnographic phenotypes. The parameter is important to maximize the chance to identify the candidate for MAD treatment. In previous studies, CPAP pressure and the polysomnographic PSG phenotypes, sleep stage dependency, and positional dependency were associated with MAD treatment response. However, it was not fully be elucidated, especially in patients with moderate to severe ulcer. Thus, in the article, we recruited 128 patients with moderate to severe ulcer who were treatment naive and received MAD treatment for 3 to 6 months. We defined two criteria of the MAD response showing over the right-hand table. We also defined PSG phenotypes, positional dependency as the ratio of HI during supine and non-supine sleep, and sleep stage dependency as the ratio of HI during REM and non-REM sleep. All the sleep duration were over 15 minutes. In the results, the MAD response rate was 25.8% in criteria 1 and 48.4% in criteria 2. In the PSG phenotypes, there were 80 patients recruited for positional dependency analyzed and 119 patients recruited for sleep stage dependency analyzed. The response rate was higher in supine predominant ulcer compared to non-supine predominant ulcer, and supine predominant ulcer was associated with MAD response in criteria 1, while the sleep stage dependency was not associated with MAD response. In multivariate analysis, CPAP pressure was associated with MAD response independently of both PSG phenotypes after adjust age, gender, BMI, baseline HI, and sleep stage dependency or positional dependency. The AUROC were 0.64 in criteria 1 and 0.66 in criteria 2. To maximize the sensitivity to identifying patients who may benefit from MAD treatment, the CPAP pressure over 14 cm of water was selected for predicting MAD non-responders, with sensitivity and specificity of 93.9% and 13.7% in criteria 1, and 95.2% and 18.2% in criteria 2 separately. There were some limitations in our study. First, the small cohort group with small each PSG phenotype subgroups may underestimate the power of the study. However, we still confirm the association between MAD response, positional dependency, and CPAP pressure. In addition, the study may limit the generalizability of its implications because we recruited only Asian patients who use customized monoblock MAD, and we excluded patients treated with BPAP, and the level of the CPAP pressure was titrated manually. Further study with the CPAP pressure obtained from auto CPAP in a large-scale and multi-ethnic cohort to validate the finding of the present study is warranted. So, in conclusion, our study found that in treatment-naive patients with moderate to severe ulcer, lower CPAP pressure and supine predominant ulcer were associated with MAD response, while sleep stage dependency was not. And CPAP pressure over 14 centimeters of water could be a sensitive measure to identify MAD non-responders. Thank you.